The other small part, we already discussed that, but it's also connected to subcrestally placed implants, is machined part position. And I just quickly go back and I just quickly remind that here you have again two implants. Both of them have platinum switching. Both of them have conical connections sufficient enough to be placed subcrestally, but this implant has no polished part and this implant has polished part. So you can see that this implant has only bone remodeling but no bone loss, but here you have bone remodeling and bone loss. So even if the implant has two things, it has platinum switching and stable conical connection, is still not sufficient. You still have to have third option, third detail, no polished part vertically. It can be horizontally, as we discussed, just at the top neck of the implant, because as you saw, especially for subcrestally placed implants, you have the ingrowth of the tissues which stops at the neck of the implant. And when this part is polished, I think for the soft tissues maybe even better. You can really touch it, and be stable. So three things we must really control, and all of this is controllable. That's your choice. I mean, you're not designing the implant, but you are choosing it. So choose the one which meets all the requirements, instead of using those which do not meet those, and then, just wondering, so why my bone is going away. Now, there is a very nice study done in Belgium, and I always quote this because it's actually the first clinical study to prove that subcrestal implant placement is a reliable technique for vertical soft tissue augmentation. So what this study was about? Actually a very good study, because it was split mouth design. So you can see that for the same patient, two implants were placed, like as abutments for provision for removable restoration. Those were restored with the locator abutments, and all of them were thin tissue patients. And one implant was placed subcrestally, and the other implant was placed just at the level of the bone. So from scientific point of view, you cannot have a better study, because it's a split mouth design. The same patient, one side, one implant, the other side, different position of the implant. So all confounding factors are really removed. And what the study outcome was, that after 2 years, there was no bone loss, only 0.04 millimeter around implants placed subcrestally, while about implants placed at the level of the bone was about 0.67 millimeters of bone loss. And when you look at the brand of the implant, so the study used AstraTech implants, which have platinum switching, which have stable conical connection, and which has polished part, but only on a horizontal platform, only horizontally. So this implant really met all these three requirements I discussed. That's why it had only 0.04 millimeters of bone loss compared to the implant which was placed at the level of the bone. So some wrap up of this part about subcrestally placed implants. Key things you must know. So first of all, implant to be placed subcrestally has to have platinum switching, one. Conical connection must be not more than 20 degrees. So 20 degrees is the final frontier for the conical connection. I mean, the difference, let's say, between 20 and 5, there is huge. But that is difference we're gonna discuss when we talk about prosthetics, because I called it closed conus or open conus. Up to 6 degrees, it's closed conus, conical connection. If it's more, it's open conical connection, and that has influence on prosthetic versatility, has influence on how do I choose prosthetics. And we will discuss this later. And final requirement for the implant, which can be placed subcrestally to increase soft tissue thickness, is that polished part should be absent, or, if present, just horizontally at the neck of the implant. No polished part below the implant neck.